Welcome to the 5th Mayor's Senior Symposium. We have a wonderful panel today, and we're going to be discussing how to access DC government services. We're going to start with, to my left, Karima Holmes. Ms. Holmes was appointed by Mayor Muriel Bowser to serve as the Director of the Office of Unified Communications. OUC consolidates the emergency 911, non-emergency, basic city services like 311 call initiatives and activities, as well as Metropolitan Police Department, DC Fire, Emergency Medical Services, and the Mayor's City Call Center. A seasoned public safety professional, Ms. Holmes started her career on the front line as communications officer, handling incoming 911 calls, dispatching responders to incident locations. Throughout her career, Ms. Holmes has also held a number of other vital positions, including acting assistant director, sergeant, quality assurance supervisor, training coordinator, standards manager, in professional development and improving morale, as well as community engagement and outreach activities. Ms. Holmes attended John Jay's College of Criminal Justice, completing her BA in Criminal Justice and receiving her Master's of Public Administration with concentration in Homeland Security from Augusta State University, where she graduated cum laude. Ms. Holmes also holds an emergency number professional certification from the National Emergency Number Association. Ms. Holmes is directly to my left. Claudia Schlossberg, who's in the middle. Claudia Slosberg is a Senior Deputy State Medicaid Director for the Department of Healthcare Finance for Washington. DHCF provides health insurance coverage to over 260,000 low-income residents of the District of Columbia. Ms. Slosberg is a member of the executive management team and oversees policy development, healthcare operations, program integrity, long-term care, and implementation of healthcare reform, including coordination of eligibility for the district's state-based marketplace. Previously, Ms. Slosberg served as a DHCF's Director of Healthcare Policy and Research Administration. She has over 30 years of experience in healthcare policy, program administration, and regulatory affairs. Her prior public sector experiences include Director of Office of Regulatory Affairs for the CLASS Program, Administration on Aging, the Senior Policy Advisor, Acting Director of Programs, Policy, and Training for HHS, Office of Civil Rights, where she was responsible for promoting compliance with the Olmstead versus LC, Title II of the Americans with Disabilities Act, and Title V-I of the Civil Rights Act of 1964. Ms. Claudia Slosberg has worked with healthcare providers as a consultant and as a partner of the government affairs specialist at the law firm of Blank Rome in Washington, D.C. She also has served as a director of policy of advocacy for the American Society of Consultant Pharmacists, founding director of advocacy and elderly at the Columbus School of Law and Catholic University, and has twice been appointed to monitor federal consent decrees involving the provisions of healthcare services to older adults and people with serious disabilities. She is a 1991 graduate of Antioch School of Law and a member of the DC Bar. Third, but not last, is Laura Green Zeilinger. Ms. Zeilinger is a director of the Department of Human Services and is responsible for a 973-person agency that is charged with assisting low-income individuals and families to maximize their potential for economic security and self-sufficiency. Ms. Zeilinger is an attorney with a long-standing commitment to understand populations. Most recently, she has served as an executive director for the United States Interagency Council on Homelessness, where she was responsible for the implementation of Opening Doors, federal statistic planning and to prevent and end homelessness, an effort that includes coordination of federal homelessness policies among 19 federal departments and agencies, as well as partnerships with state and local communities, nonprofits, and the private sector. She joins USICH in 2011, and prior to her appointment as executive director in 2014, she served as the deputy director. Ms. Zeilinger is an alum of Sarah Lawrence School and graduated from the Washington College of Law at American University. Before we begin, I would like to actually make one announcement. If you have a wonderful cell phone, can you please turn your ringers off and put them on vibration if you need to have them on? But we would like to welcome Ms. Holmes from the Office of Unified Communications. Thank you.
Good morning. As Mr. Gerald pointed out, I'm Karima Holmes. I'm the Director of the Office of Unified Communication. That's your 911 and 311 center. One of the things that he may have not known, but when I was appointed by Mayor Bowser, I came the week of the blizzard. And so that was really fun, especially because I'm from Georgia by way of Dallas, and I had never seen that much snow in my life. But it was nice. I definitely got acclimated to the area. What does OUC do? We're responsible for 911. This agency was established in 2006 to consolidate the police, fire, and EMS dispatch and 911 for the district. We receive 911 calls. We receive about 1.4 million 911 calls a year, and that's about 3,000 calls a day. We dispatch for police and fire and EMS. We also have partnerships with Harbor Patrol, Capitol Police, Park Police. Therefore, if we're receiving calls that fall into their jurisdiction, we have interoperability with these other agencies to make sure the response is sent out. We also are responsible for 311. We receive a little more 311 calls a year than we do for 911. We receive about 1.8 million calls a year for 311, and that's, I'm sure most of you have used this service before. We're responsible for service requests for DPW, DDOT, DMV, Department of Energy. All those calls come into my center. I have about 70 employees that are responsible for the incoming calls for 311. We also, the bulk of our calls come in is just for general information for the district. Individuals that are here living or visiting call 311 and request service or ask for service about different agencies in the district. As for our 911 side, 911 is used to report any type of crimes in progress or emergency calls. That's anything that threats to life or property. You're to call 911, report any fire or medical emergencies. Also, any vehicle crashes that involve any type of injury. Right now, MPD is requesting that if you have a minor fender bender to exchange information and contact your insurance companies. And this is just to help down with the amount of officers that are being dispatched and having them free up for actual emergencies. Always remember that you can remain anonymous. When calling 911, you can just let our 911 operator. I think a lot of calls do not come into 911 because the caller is a little skeptical to know if their information is being shared. So you're okay to say that you would like to remain anonymous. You do not want an officer to come knock on your door. You just want to report something. We're also completely accessible to the hearing impaired. We do have TDD and TTY accessibility in our center. And also our non-English speaking citizens and visitors. We also utilize the language line for that. One of the other things that I like to point out when I'm doing these presentations is always remember when you call 911, the person on the phone with you is getting the information and we're sharing it with another dispatcher. We're considered a horizontal dispatch center, which means we have call takers and we have dispatchers. And so during an emergency, we're all in a rush, right? Get somebody out here. Just know that that call taker, she's asking you a great deal of questions, but she's putting that information into our software that gets the information out to the dispatch, who relays the information over to dispatch. I want everybody to understand that us asking you questions does not hinder the response. We have technology in the system that in the center that as soon as we get a call, we put the address, we put the telephone number in, we're gathering information, but we're just sending it out. It's in real time. We're just sending it out, and another individual, a dispatcher, is getting that information, and they're over the radio and they're relaying that information. We also have a service, Smart 911, that is completely free to you. You can set up a Smart 911 profile by going to smart911.gov. smart911.com, and you can set up a profile of your residents. And so if you have anything, I know I had a couple constituents that set up this profile because they have oxygen in their house. And so if anything happens where you have the fire department coming out, you kind of want to let them know that. That is something we would like for you to share with 911, but there may come a time you call 911 and you can't share it. Or somebody else in your house calls 911, or a visitor calls 911 in your residence and they don't know that you have an oxygen tank in the basement or for whatever reason. So there's different reasons you can set up 911 for it. I have it at my residence, and I have it set up. I don't have any medical conditions, but it's me. I have a 9-year-old son. I have my mother who's here that lives with me. So we have a profile there to let them know who stays in the house, and therefore when you call 911, this information automatically pops up, and we have a little more information for you. As far as 311 services, right now you have access to 311 services by calling 311. We also have a 311 app that you can download at the Play Store to get in contact with us to put in service requests. Soon we will be offering text to 311. We will have a live agent on our web portal. So if you sign on to our web portal, there will be an option at different times, usually our peak times, where there will be a live agent that will be able to talk back and forth with you. And this is to counter our growing hold volume. I don't know if any of you guys have had to call 311 lately, but with the summer hours, our hold volume is getting really long, and so we're trying to counter that and give you other options. These options will be live in September, and you'll hear more about that. And lastly, we have community outreach that we're pushing. We've always been really active in the community. Ms. Wanda Gaddison, who's here with me today, she's responsible for that, but we're trying to push it out more. And this is because you get to see police and firemen all the time. You see them on the streets, you see them responding to things, but you guys never really get to see us, the 911 operators. And the only time that you have contact with us is usually in a negative light. When you need something. Even on the 311 side, you're usually calling because somebody's parking in your parking space. You need your trash picked up that wasn't picked up. So usually when you have contact to my department, it's usually when you're in some type of situation and you need help. And so what we're trying to do is be a little more proactive in our community and talking about what we do. Therefore, when you call us, you have more of an understanding why we're asking you questions and what we're doing. So we're definitely pushing that out. I think Wanda just wrapped up, is it Beat the Streets with MPD? We were out giving out information for that, and as I mentioned before, she is on the second floor. And I think that's it for me, Gerald, and I think we're going to hold questions to the panel.
To the end, yeah.
Okay, thank you.
Good morning. As Jerry has already introduced me, just so that you don't forget, my name is Claudia Schlossberg, and I am the State Medicaid Director for Washington, D.C., and the Senior Deputy at the Department of Healthcare Finance, or we call it DHCF. We are responsible for the Medicaid program, the Alliance program, and the Immigrant Children's program. Together, those programs insure over 270,000 district residents. More than 1 out of 3 individuals who live in the District of Columbia are getting their health care through Medicaid or the Alliance. So it's a very, very important program, and a very important program for seniors as well. One thing that I want to share with you is how proud I am of the district's commitment to making sure that all of its residents, even those who don't have the correct immigration status to get Medicaid, have access to health care. When Obamacare was passed back in 2010, we were one of just a handful of states that expanded coverage for Medicaid to childless adults. And we have some of the most generous coverage levels in the country, and we cover more people. As a result, we have one of the lowest rates of uninsurance in the country. We're up there in the top 3. So that's something that you can be very, very proud of as a resident of the District of Columbia, that we have a commitment to making sure that people have access to health care. For low-income seniors, the Medicaid program is very important. We are one of the primary funders or payers for long-term care. If you need to go to a hospital and then have to go for some rehabilitation in a nursing facility, or if you need long-term care services, as some of you probably already know, Medicare doesn't pay for a lot of any long-term care services. It's really the Medicaid program that covers you. We also provide premium and cost-sharing assistance for low-income seniors who are on Medicare. As you know, if you're on Medicare, you have to pay a premium every month, and you have some cost-sharing. But if your income is lower than 300% of the federal poverty level, then you can get some help from Medicaid to pay those premiums and to help you pay your cost share when you go to see your doctor under Medicare. We are working really, really hard, have been working really, really hard to try to make access to long-term care services easier. The Medicaid program is one of the most complex programs imaginable. The rules are written by members of Congress and by federal bureaucrats, and then we have our own rules, and it really is tremendously complicated, even for people like me who work on it every day. It's very hard for people like you who don't sit there and study these rules to try to figure out, how can I get access to care? So one of the things that we've been doing is partnering with the DC Office on Aging, with Jerry and Laura Newland and her staff, to try to smooth the way and make it easier for people who need services, who may not even know what they're eligible for or what services they need or want, to get the help they need. And what we're working on is called a no wrong door system, meaning wherever you call, we're going to get you to a place as quickly as we can, and that place is going to be the Aging and Disability Resource Center, ADRC, at the Department of on Aging, to get you help, to help you navigate and negotiate to get the services that you need, whether they're Medicaid-funded services or whether they're services through the Office on Aging or maybe even private services. We are working to make this as smooth and as streamlined as possible. We also work really closely with our partners at the Department of Human, DHS, Department of Human Services, I wanted to say resources for some reason, services, and the Economic Security Administration, ESA, on eligibility issues for Medicaid and for the Alliance. So Laura's going to talk in a bit about some of that. But again, we work very closely with our partners to try to streamline the process and ensure that we're addressing any issues around wait times. In fact, we've eliminated any kind of backlog or waiting list for the EPD waiver, our elderly and persons with disabilities waiver. We provide a range of services for people who want to stay in their own homes. Most importantly, personal care assistance services. We also have a new adult day health program. This allows seniors who have some medical needs and may need some help during the day to go to a center where they can get a hot meal, have activities, get help with their medications. There's nursing supervision there, so if they have some nursing needs, those can be taken care of. It's a very, very important program, and we're hoping that more seniors will take advantage of it. We've also started a new program in our waiver called Services My Way, which is for, again, if you're eligible for the waiver, you can now you can employ your own personal care attendants, and you are the employer. You don't have to go through an agency to get help in your home. You can also hire a relative or neighbors or a group of neighbors to help, and they can be paid to provide the personal care support that you need. The last thing I'm going to say is this. It is very, as I said, very complicated trying to sometimes access Medicaid and other healthcare services. And even if you have private insurance or Medicare, sometimes it's just very confusing. You might get notices in the mail, you don't understand them, or something happens and suddenly you don't have access. Somebody says your services are cut off, or you can't see your doctor, or your insurance company says, no, that's not covered. Whatever the issue is, if it pertains to, it's about your health insurance, whether it's Medicaid or private insurance or Medicare, you need to know about the DC Healthcare Ombudsman. How many of you know about the DC Healthcare Ombudsman? Well, some of you, good. So they have a booth here. The program is run out of our office. Maud Holt is the director. Her staff are here today. They are upstairs in the exhibit area, and they can help not only answer your questions, but they can be, and they are, your advocates. So if you run into a problem with your health care, please remember, I brought some brochures so you could all see. The DC Healthcare Ombudsman is a very, very critical, important resource for all of you here around any issue having to do with your health care. So let me end there. I know we're going to take questions at the end. Thank you so much.
That was great. I learned a few things. Then, my name is Laura Zeilinger, Director at Department of Human Services, and we provide a broad range of services and supports to residents in the District of Columbia, both in our Economic Security Administration programs and in the Family Services Administration. In the Family Services Administration, that is where a lot of the social service and support programs are housed within the Department of Human Services. Many people may have heard of our Adult Protective Services program. Adult Protective Services provides an intervention where for adults in the district who may be abused, neglected, suffer from self-neglect, or exploitation. And so if you know somebody, or if there is any exploitation happening where you need an advocate, you can reach our Adult Protective Services program. They will provide services to any resident who is over 18 who is vulnerable to abuse or neglect, exploitation because of a physical or mental impairment. They will investigate recent instances of possible abuse or neglect, and they will be able to come in, investigate, and take appropriate actions to protect the health and welfare. Those services can be requested very simply through our partners by calling 311, and we have a hotline that operates 24 hours where we can respond. But we also, our Adult Protective Services Unit also works closely in collaboration with a number of other agencies in Health and Human Services. We will work with MPD when it's a criminal issue, with our Department of Disability Services, with Office on Aging, Health, and others, because oftentimes there are people who are coming to our attention through Adult Protective Services may also have services and supports that are coming through other agencies, and they can also be an advocate for helping make sure that we are that folks who may need our support are able to access and welcome that support. Just to give you a sense of scope, over the course of the last fiscal year, we received 3,248 calls to our hotline, and about a third of those then meet the criteria. Sometimes people are just looking for, how do I get help with this, that, or the other? A third of them actually met the criteria for Adult Protective Services. In terms of just notable trends and what we see happening in the Adult Protective Services space, and this probably will not surprise you with some things you hear about in the news, is that there really is an increase in financial exploitation of seniors, and that is something, again, that Adult Protective Services can be involved in helping protect. Also, through our Family Services Administration, we provide a range of different more flexible services and supports through our Strong Families program, which can be a more nimble crisis intervention, social services entity when there are things going on in the community that where somebody needs to be able to access some help or support that may not fall clearly as, for example, an adult protective services issue, but somebody still needs, they're not being exploited, but they still need to figure out how to get help with something. And they do everything from connect people to a resource to help them pay their utilities if that's an issue, to a whole range of other things. We also provide homeless services, which is quite a large and visible program within the Department of Human Services that we operate in partnership with a lot of local and community organizations. And we see that within the population of people who experience homelessness, a lot of very, very young people in families, as well as a lot of seniors. When we talk about family homelessness, the time that people in their life are most likely to experience homelessness is actually in their first year of life. The birth of a child often precipitates for a woman her first instance of homelessness. And we see that a lot in terms of what we see in terms of homelessness on the family side. And for single adults, it is an aging population, and the majority of people who experience homelessness and chronic homelessness are on average around the age of 55 in our system. And so the solutions to homelessness that we're focused on are really access to affordable housing with the services and supports that can go with that person so that they have what they need to be able to live integrated in the community. We serve about a third of district residents through our Economic Security Administration, which is where we do eligibility for the long-term care program that Claudia spoke about, as well as for food stamps or supplemental nutrition assistance, and as well as interim disability assistance and cash assistance through the TANF program. So if somebody who is a caregiver of a grandchild, even if they're not, so if you have a minor in your home and you're caring for that minor, you could still be eligible for TANF, and that does provide cash assistance without there also having to be a work requirement. We, in our interim disability assistance program, that is for individuals who have applied for Social Security disability insurance and are waiting their determination with the Social Security Administration. We do have a waiting list for that program, but as new people get onto SSI, we're able to take new folks into that program, and it allows the district to provide a cash benefit that can be a bridge until somebody's Social Security can start. It's an important protection for people who need that cash assistance. One thing that I think is also important to know about is the ways in which we try to make our services accessible to people with disabilities. So if you cannot come, if you think you might be eligible for benefits and you cannot come into a service center because of a disability, that you can call us. We can do the majority of an application by phone and then have somebody actually go out and do either a home visit or work with a community worker to come out to a person to complete their work with the agency. So it's something that if folks need, they can take us up on. I'm going to conclude now so that we have time to be able to take your questions. Thank you.
As you see, we have a wealth of knowledge on the stage, and I'm sorry, since we started a little late, I was rushed and I didn't introduce myselp. I am Jerry Kasunik. I'm the DC Office on Aging's Deputy Associate Director for the Aging and Disability Resource Center, and I work with all three of these wonderful divisions as well as these ladies' staff every day. We are opening the floor for questions. Any questions?
I'm Carolyn Nicholas. I am a Commissioner on Aging, appointed to represent Ward 4. I also am the President of Advocates for Elder Justice, Hilda and Charles Mason Charitable Foundation. I have a question for
Claudia.
Call me Laura.
Okay, Laura Zeilinger.
Zeilinger.
Okay. What does Adult Protective Services do to protect elderly DC residents who are financially exploited?
Okay, so the question was, what does Adult Protective Services do for people where there's a case of financial exploitation? We would do an investigation to verify whether that is indeed the case, and then we would work with, in a case like that, it's usually there is often criminal conduct, and we would then work with appropriate law enforcement authorities, but also help the vulnerable adult understand what is available to them in order to protect their assets, in order to be able to, a variety of things they can do to protect themselves. So we are not, we don't do that criminal, we wouldn't then take the case and prosecute criminally. We work with our partners in MPD and the Office of the Attorney General once there's a case that's substantiated. Sometimes there is other issues where you have family members present who are taking people's checks, and there's sometimes other different ways in which to navigate a situation, whether it's something predatory that's happening from a stranger over the phone or instances among family members. And we certainly do modify our approach based on the situation that is happening and the interest of the person who we are there to protect.
Okay. Do you, or does Adult Protective Services investigate jointly with the Metropolitan Police Department? Because privacy and confidentiality, I know, are a concern, and sometimes blocks the ability to complete an investigation because the information cannot be shared. So Montgomery County Police and Adult Protective Services investigate jointly. Does DC do the same?
So we work very collaboratively with MPD, and if we need to be approaching something jointly, we can definitely bring them in. But we assess when that is appropriate, and yes, we can do a joint investigation when warranted. But I don't believe that we do that as a matter of policy, if that's what you're asking.
Yeah, and I would like to see that.
Thank you for the suggestion. I will bring that to our team.
Thank you.
Good morning. My name is Jalil Mutakaibir, and I live in a long-term care residential facility. And my question is, I need a contact person who is responsible for writing DC law governing long-term care, assisted living residential facilities. The law that we now have is old, outdated, and it really does not provide protections for the resident who is complaining, especially in complaints involving financial exploitation, insurance fraud, being charged for services that you don't get or don't need. I'm also a volunteer long-term care ombudsman, and so I attend monthly meetings and I hear about what's going on at other assisted living facilities. Something needs to be done. For 2 years, I have been trying to locate the appropriate person to speak with. I have met with Anita Barnes. I have sent information to the DC Council, Health Committee, and I'm not getting any responses. And I know that there's somebody that I should be able to talk to bring this issue forward, and so that something can be done about it.
The answer to that question, I believe, would be Dr. Sharon Lewis at the Department of Health Licensing, Regulation, and Administration. And I'll repeat that. That's Dr. Sharon Lewis, DC Department of Health Licensing, Regulations, and Administration. And if you would like, you can probably call the Information Referral and Assistance line through the DC Office on Aging. That number is 724-5626, and we can make this soft transfer to her office. Okay, so that's 202-724-5626 for the Information Referral and Assistance line through the DC Office on Aging, and we can connect you. Okay?
Thank you. My name is Betty Smalls. I live in Ward 6. My question is regarding Medicare. A few days ago, I called my primary physician to make an appointment, and my request was to have a complete physical exam. And at that time, I was told Medicare does not cover physical exams anymore if you are a certain age. And I would like to know what's the rationale for that, or why?
I believe your question is about Medicare coverage, correct? Medicare does cover a physical exam. So if you're hearing something different from your physician's office, you might want to get in touch. And can I? Carmen is right here in the front from the Ombudsman's office, and she can probably talk with you and get some information, specifics. We don't need to talk about that publicly, but we'll have you two talk because, again, complicated, but Medicare should be covering a physical examination. I think it's annually, so we'll make sure you two talk to each other.
I heard you make mention of the 311 call for parking spaces. I have a handicapped space on the street, and when someone's in it, I was directed to call 911 instead. But I want to know what the actual protocol is, and I found that officers frequently don't know how to write the tickets. They don't know what to do. And, I experienced a very bad situation at one time with an officer who looked the tag up, looked up the truck that was in my space, and found out it was somebody down the street, went down the street, and that person told him, oh, sorry, he was walking his dog. But there was an empty space in front of his house.
Right.
And once I found out who that was, but the officer says, well, I have the option to write a ticket.
Right. So I can't really comment on the MPD or parking enforcement regulations. I would definitely ask you to call 311 and get in contact with that department to find out how they do. As far as whether to call 311 or 911, it would definitely be 311 unless you find that there's, yeah, well, that's one of the things that I found, and it's not just unique here in the district, that is just an easy, accessible number, 911, someone's always there. But here in the district, we have 311 that's also 24 hours. And so what we're trying to do is just kind of get away from calling 911 for what's considered not an emergency. So we do have 311 operators. We're actually in the same arena. So for that situation, I would call 311 unless you're having an argument or you're having some type of problem where you request MPD. And I think if you, right. Okay.
Told me to call 911.
Oh, really? Oh, wow. Okay. Oh, yeah. Okay. I'm sorry about that. Yeah. But 311 would be the correct number to call, and we would get you with the right response.
So,
You're welcome.
thank you. We'll take our last question right here.
In Wicker Ward 5, just a suggestion. I'm aware of all the hard work that the Department of Healthcare Finance is doing. I want to congratulate you. However, I would suggest some more sensitivity workshop, especially for your workers at 8th Street and those other facilities. I had the opportunity to take one of my seniors there, and the response is outrageous, the way they talk to some of the seniors. So I suggest periodically more sensitivity training.
Thank you.
Thank you for that feedback. It's actually the Department of Human Services who does the eligibility there in H Street and at the service centers throughout the district. We are launching a very robust effort to improve our customer service and also agree that it's an issue. So you hopefully, as you come back, especially over the course of the next 6 months, you can expect things to be very different. We are doing a complete redesign of our business process that will change how that will allow us to complete all of our work with an individual coming in while they're there, so that we don't have people coming back to drop off. But we also are changing everything that happens from the time somebody is greeted to the time they finish business. It's like all change, it will be a little bit it will create a little bit of sort of friction while it's in process, and we may see some longer wait times while we adjust to a new business process that will then, in short order, I think fundamentally really improve the experience of residents coming in to our service centers around the types of issues that you described. I also notice that a lot of people go through a lot of painful effort who have mobility impairments and other issues to just even get to a service center. And there are a lot of ways we can accommodate people who, either by coming to them in their home or by making appointments so that they're not having to wait. And so if you need that type of accommodation for somebody you're accompanying, please do reach out and we can work out something so that we have a special process for those who do need that in order to access the care and services. But I appreciate the feedback, and it's something that I care a lot about fixing, and I feel the urgency on it, but also want to not overpromise how quickly you will see it different, but I promise you will see it very different very soon.
Thanks, everybody, for your questions.
Thank you. I'd like to have a nice warm round of applause for our panelists. If anyone did not have a question answered, if you wouldn't mind writing it down and handing it to me, and I can probably get an answer for you within the next couple of business days, I would appreciate it. But this does end our panel, so thank you.